Hello, my name is Sammy Lee, and today I will be talking about ethics. Ethics is defined as how a man should live in terms of morality. It deals with rightful and wrongful acts without considering the scientific aspects. It is a broad concept of whether something is good or evil. As Richard Taylor puts it, the question of what is good is certainly the most important question one can ask. Simply put, morality is subjective. Not everyone will agree with what he or she is thinking. Ethics has its own theories, two of them being teleological and deontological. In teleological theory, one considers an act moral or immoral based on whether it helps achieve something in one end. Three types of teleological theories include egoism, which is happiness or pleasure, eudaimonism, meaning well-being, and utilitarianism, which is general good of mankind. On the other hand, in deontological theory, the morality of an act involves an authority, regardless of the result of a certain action. This theory came from divine law, based on Jewish and Christian perspectives. In the second week of classes, I learned the four elements of ethics. They are the preeminence of reason, the universal perspective, the principle of impartiality, and the dominance of moral norms. The preeminence of reason simply means we must think critically. The universal perspective states that morality that is applied in one situation must be applied to all other relevant situations. The principle of impartiality is the idea that everyone needs to receive an equal amount of interest and welfare. Finally, dominance of moral norms is the principle that moral norms always defeat non-moral norms. I am an allied health major, but I'm in the physical therapist assistant pool. I would eventually like to get my PTA license and work at a medical facility, such as a sports rehabilitation clinic. Understanding ethics can help me perform morally when I'm working at a real job. For example, people come into various medical facilities daily to be treated. Medical professionals that aid their patients include, but are not limited to, doctors, physical therapists, and physical therapist assistants. Usually, the majority of the treatments satisfy the patient's needs, but there are times when they're not always pleased with their visit. The ethical issues that arise the most involve the rights of patients as well as the duties of the healthcare providers. One should consider informed consent, euthanasia, and paternalism. Informed consent is a notion where the provider must provide the patient complete information about the conditions, treatments, and risks involved in certain care so that the patient can be self-governing and decides whether to take part in that care. The patient should receive this information only when he or she is in a rational state of mind and only when he or she is ready to accept or reject a consent. Unfortunately, there are occasions where the patient does not receive full information about certain conditions and risks which could negatively impact them. For instance, in 1994, a woman who had breast cancer did not acquire the knowledge that she could undergo a bone marrow transplant. And in 1995, another woman was not told that she could visit specialists who would help with her physical condition just as a checkpoint of her physical well-being. She was later diagnosed with breast cancer. From both scenarios, this shows the ignorance of providers due to the lack of communication between providers and patients. Similarly, euthanasia is an important branch of healthcare that is divided to sub-branches. Each of the following terms expresses unique meanings. Active euthanasia is the idea that the patient must execute further actions on himself to speed up the process of his death, such as taking an overdose, whereas passive euthanasia means that providers cannot do anything to save the patient's life in the first place, so they stop treating him and allow him to die. Another ethical issue that is scattering around hospitals today is paternalism, the concept that healthcare providers act like a father figure to their patients. They limit choices that patients should be able to make, regardless of the patient's self-interests. It seems that doctors do not care about the possible risks that could happen to the patients. This is clearly wrong in the world of healthcare as it contradicts to the patient's Bill of Rights. The Patient's Bill of Rights states that the patient have the right to refuse treatment to the extent permitted by law and the right to be informed of the medical consequences of his actions. Having knowledge of these issues will allow me to think while I act in the medical field. I need to be aware of what is good and use my own knowledge to make decisions that will end up benefiting patients. Ultimately, ethics is a big deal in life. Thank you very much.